core pyramid. So you can see the layers of the core, right? So the bottom layer is the core anatomy. So this is going to be the foundation of your pyramid. It's knowing what makes up the core. So knowing what the core actually is, okay? Next, we're going to dive into those layers a little bit more. So we'll go into the core structure, starting with the inner unit and then moving to the outer unit and how to activate both. And then finally, after you're able to activate those core muscles efficiently, you'll learn how to control them with more functional tasks that you guys need to be doing. Your gardening, your pickleball, your walking, running, those kind of things. And then ultimately finishing at the top of the pyramid with a strong functional core. So here, we're going to jump into some anatomy of the core. If anybody has questions, feel free to ask as we're going. So there's 4 muscles of the inner unit, and you can kind of see how they work. They form a box of sorts. So you can see number 1 is your pelvic floor. So I always think about this. This is the bottom of the box. You can kind of see how it forms that basis. And I always say it's like when you're putting up a house, you have a foundation. Those of us that live in Easthill know our foundations are all wonky, right? Same thing. If you don't have a strong foundation, kind of everything else like has to work harder or doesn't do its job as efficient. Same with the core, right? The front of the box is called your TA, or your transverse abdominis. The number 3, the multifidus, is the back of the box. And the way I explain this is they're like when you see those big cranes and they have those little guide wires that anchor them to the ground. They're little guide wires from each segment the whole way up your spine, from your tailbone to your head, and they help stabilize the back of the box. That's your multifidus. And then finally, the top of the box is called your diaphragm, and that's just breathing, right? So a lot of people will hold their breath when they do these kind of things. So I'll teach you guys how to do that. But you can kind of see the diaphragm and the pelvic floor, they kind of work as a pump together. So they'll work together in tandem, okay? So that is your inner unit. Your outer unit, it kind of builds, and it's the next outer layer towards that inner unit. So I call them slings. So the sling is made up of a couple muscles and a couple bands of fascia or connective tissue. So the first one you see there is called your posterior oblique sling. So this is made up of your gluteus maximus and your contralateral lats, or latissimus dorsi. So you can kind of see those green arrows. They form like an X over your back, over your pelvis. You see that? So that's how it snugs everything together and stabilizes it in that spot, okay? It kind of works like a smart spring. It stores and releases energy, especially with like walking and tasks that you have to do, okay? Number 2 is the lateral sling. This is made up of the gluteus medius minimus, so your deeper glute muscles, your ipsilateral adductors, so down the leg, in the inside of your leg or your groin, and then the contralateral or opposite side QL. So it essentially, what you're looking at is your glute on one side, your adductors, and then the opposite side QL. So it helps to stabilize, especially when you're on one leg. Really important for walking, running, okay? Number 3 is called your anterior oblique sling. So it's very similar to the posterior oblique, except instead of being in the back, it forms an X into the front of the core. So that's made up of your adductors and then the same side obliques, internal obliques, and then your opposite external obliques. So there is a bit of a rotational component to your core. Some of us might not tolerate that rotation. So I'm going to teach you, I call it anti-rotation. So you're going to be resisting that rotation. I'll teach you that as we get into them, okay? And then number 4 is your deep longitudinal sling. So this works with your biceps femoris, so your hamstrings, and then they work in tandem with some of your muscles on the lower leg below the knee. So that's like your peroneus longus and your tibialis anterior. And what that does is it basically creates a stable base or platform for you to work on, okay? So that is your slings in a nutshell.